There are various patterns of antibody. These are what's seen in indirect immunofluorescence. This pattern is called diffuse homogeneous pattern, homogeneous or diffuse nuclear pattern. To understand this, all cells are taken the stain, the green stain. All nuclei are taken the green stain, so it is positive. All the nuclei are taken the green stain, bright green stain. So it causes nuclear positivity. Diffuse homogeneous nuclear positivity. And what this elongated thing you see, this is mitosis. So the mitosis is also stained, elongated thing. So all the nuclei are diffusely homogeneously stained, diffuse homogeneous state, and the mitosis is stained. This is called homogeneous or diffuse nuclear pattern. This pattern is seen in antibodies against histone, chromatin, and also in antibodies to dsDNA. Antibodies against histone, chromatin, antibodies to dsDNA, etc. can cause this diffuse homogeneous pattern. All the nuclei are stained, diffuse homogeneous staining, and mitosis is stained. So this is seen in antibodies to histone, chromatin, antibodies to dsDNA, etc. Okay. Now the next pattern. Here the not as in the previous slide, it is not as diffuse homogeneous. It is a speckled pattern of stain. One speckles here, one speckles here. Speckled pattern of staining. And what happens to mitosis? Mitosis is linear thing. Here mitosis is this, and here mitosis is here. Here mitosis is not stained, but here mitosis was stained. Okay. So mitosis is not stained. There is speckled pattern of staining. This is nucleoli. Nucleoli also is not stained. This is called a speckled pattern. This speckled pattern is found in antibodies to SM antigen. Antibodies to SM antigen. Okay. Antibodies are also antibodies to SSA, SSB, etc. SSA is also called Rho, and SSB is called anti-Rho, anti-Lo antibody. So speckled pattern of staining is seen in antibodies against Smith antigens and also SSA and SSB. SSA and SSB is found in which autoimmune disease? You know, SLE is there, systemic sclerosis is there, Sjögren syndrome is there. Which one is this SSA and SSB seen? Do you have any idea? Can you comment? Okay, anti-Rho, anti-SSA, anti-SSB antibodies are found in Sjögren syndrome. Okay. So these are speckled pattern. Then there are antibodies to RNA. Then there are anti-centromere pattern. This anti-centromere pattern looks similar to like here. Okay, somewhat similar. Okay, speckled pattern. Then how can we distinguish? Look at the mitosis. It is stained here. But here mitosis is not stained. Okay. Here mitosis is stained. Okay. Antibodies. Mitosis is stained and somewhat speckled. It looks like speckled, but it is anti-centromere antibody. So anti-centromere antibodies looks like this. Here the mitosis also is stained. But in speckled pattern, mitosis is not stained. Okay. Anti-centromere antibodies in which condition? Anti-centromere antibody. Yes, systemic sclerosis. Systemic sclerosis, anti-centromere antibodies can be seen. So can we comment which is the pattern here? Diffuse homogeneous pattern. Okay, diffuse homogeneous pattern. Mitosis is stained. Mitosis is stained. This is seen in antibodies to histone, chromatin, and dsDNA. dsDNA is also seen in another pattern of dsDNA staining is rim or peripheral stain. Rim or peripheral stain also is seen in dsDNA, double-stranded DNA. Then this is what pattern? Which pattern is there? Speckled pattern. You can see numerous speckles, nucleoli not stained. And look at the mitosis. Mitosis is not stained. Okay. So this is seen in antibodies to SM antigen and also anti-Ra, anti-La, SSA, SSPO. It is found in Sjögren's syndrome. Then the nucleolar pattern, antibodies to RNA. Then again, which pattern is here? Anti-centromere antibody, where the mitosis is stained contrary to speckled pattern. Okay. The anti-centromere antibody is found in systemic sclerosis. In SLE, what we see is anti-dsDNA antibody and anti-SM antibody. Anti-dsDNA antibody and anti-SM antibody. So which pattern will be seen? Anti-dsDNA is which pattern? Homogeneous അല്ലെങ്കിൽ rim or peripheral stain. Homogeneous or rim or peripheral stain pattern in anti-dsDNA. That we can see when we do indirect immunofluorescence. Again, antibodies to SM antigen can be found in SLE. Yes, speckled pattern. So homogeneous and speckled pattern are more specific for this SLE. So that we can say antibodies to dsDNA or antibodies to SM antigen are more specific in SLE. The pathology is this antigen-antibody complex deposit and cause type 3 hypersensitivity reaction. Again, another antibody that can be found in this SLE, I have discussed in thrombosis section, antiphospholipid antibody syndrome. There is primary antiphospholipid antibody syndrome is there. There is secondary antiphospholipid antibody. 30 to 40% of patients with this SLE has antiphospholipid antibody. These antiphospholipid antibodies mainly directed against proteins which are complexed with phospholipids. These proteins, when complexed with the phospholipids, their epitopes get exposed. So these proteins complexed with phospholipids, their epitopes get exposed. There are different ones, like there are different antibodies like beta-2 glycoprotein. There is prothrombin, protein C, protein S, annexin V, etc. Prothrombin, protein C, protein X, then beta-2 glycoproteins, etc. One problem with these antiphospholipid antibodies, it can interact with another antigen used in the testing of another disease. Which disease? There is false positive result for that disease if the patient is an SLE. If the patient is having SLE, false positive for that disease. Which is that disease, you know? It's a sexually transmitted disease. Okay. Which is that disease? Can you comment? Yes, syphilis, anti-cardiolipin antigens. Okay. So these antibodies cross-react with this cardiolipin antigen. So it can give false positive results for syphilis. Then this antiphospholipid antibody syndrome can be associated with recurrent venous thrombosis, and also there is recurrent miscarriage, venous thrombosis, recurrent miscarriage, etc. So we have covered about SLE. It is more common in females, and female-male ratio is 9:1. Young-aged females. It is associated with malar rash, discoid rash, serositis, oral ulcers, arthritis, photosensitivity, etc. It is associated with the anti-dsDNA antibody, anti-SM antigen. So that diffuse homogeneous pattern and speckled pattern can be seen. Read more.